Hi, my name is Dr. Stephen Vath. I am a board-certified plastic surgeon with my primary office in Golden, Colorado. I also have an office in Denver. I want to chat a little bit about a common misunderstanding regarding breast implants, and that is the profile of implants. There's, generally speaking, low, medium, and high profile. There's some subtle differences with the different companies, but people really commonly come in saying or thinking they want high-profile implants because they think high profile means high up. That is not what high profile means. Think about profile as being the projection of something. Like a high profile car comes off the road higher. So if it's windy, it's more likely to get blown off the road. So you're better with a low profile car. Low profile implants are less projected. So what's the story with this misunderstanding about profiles? I can't find anybody this explained on the internet at all in an honest fashion. People come in, they think that they get a certain look with a certain profile implant. Think about the chest wall or the width of a woman's breast is set. That's your anatomy. And so if you want to vary the amount of size, then you have to vary the projection of the implant. You're not just going to make the implant a lot wider as you go bigger, because then it's going to go underneath your armpit. And you don't want an implant much narrower than your breast, because that's not going to make the prettiest looking breast. As far as profiles, if you go with a low profile implant, it's going to have that woman's breast width, but be less volume and therefore less projection. Middle profile, roughly same width, more volume and therefore more projection. And then a high profile, even more projection. So high profile basically means for a given woman, just a bigger implant. It doesn't mean high up. I use low profile implants all the time, not because it's my choice, not because it's what I want to do, but patients come in frequently saying they just want a small enhancement. They just want something super natural. People say natural all the time, and yet they're pushed by many in my profession to go bigger, thinking that they couldn't possibly be happy with a small enhancement. But I find lots of people are happy with small enhancements. Low profile implants allow you to still maximize the width of the breast while only giving a small amount of volume and therefore less projection, which actually looks more natural. Wider, less projection is what a natural breast looks like. Now, certainly if a woman wants fuller than that, wants more upper fullness, wants a bigger breast, great. That's your choice. It's your body. I'm not here to impose any of my tastes on what someone wants for themselves. Another common use of low profile implants is when someone has a fair amount of breast tissue and they need a lift. The more breast tissue you have, the more likely you are to need a lift after pregnancy. And they want to have a little bit of boost of the upper fullness. And a lift doesn't do that. And this is a whole other topic to talk about, and the misconception that the idea of a lift is going to give more upper fullness. It does not. A lift will make a breast really pretty in shape and get a nice spherical round lower pole. It's not going to give more upper fullness. These women will add, they don't want to be necessarily bigger, but they want some upper fullness. That's a perfect use for a low profile implant as well, because it just gives a little boost to the upper pole without really increasing size much. And it does something that the lift cannot do. So I use low profile implants frequently for smaller women, small breasted women who want just a small enhancement. And also for women that have bigger breasts and have some sagging, that want a little enhancement of their upper pole, but really don't want to be bigger. That's sort of a spiel on low profile implants. I'm a big fan of them for people that it fits the bill. And hopefully that clears up some misconceptions.